Good morning, Sioux Falls. I'm Joe Kipley, the Public Health Director, and this week we are celebrating National Dental Assistance Week, and tomorrow is National Dentist Day. So it's a great week to talk about oral health and some of the things we have at our city clinic, Falls Community Health. Not only do we have a medical clinic, so we've got physicians and nurses, nurse practitioners, all of those services of a primary care clinic, we also have a dental clinic. And so that's something we want to highlight today. Our dental clinic basically offers the whole range of oral health care from basic dental checkups to basic cleanings, x-rays, God forbid, a root canal or emergency care, but we're there for you when you need us. We're also there for you when maybe you don't have the means to pay. So there's very few clinics in Sioux Falls that take Medicaid, but we are one of those clinics. So Falls Community Health, if you're on Medicaid or if you're uninsured, we find a way to help serve those in our community that don't have health or dental insurance. So our goal is to make primary care accessible and affordable, and coming out of our community health assessment, we know that access to oral health care is one of the big priorities for our community. So this is kind of a week to celebrate that access and to celebrate what dental assistants do to make that available in our community. So beyond dental assistants, we have 20 staff members in our dental clinic, and we're actively recruiting for a couple dental assistant positions as well as a dental hygienist position. And just to kind of throw out there that we're pretty aggressive in our recruiting, where we're offering a hiring bonus of up to $4,000 and an opportunity to get student loans repaid through programs that the city participates in. We also have some very competitive benefits when you work at the city, so we're happy to highlight those to the future generation of workforce when it comes to dental hygienists and dental assistants. And so as we just highlight this week of oral health care, I want to invite up Dr. Susan Olson. She is our lead dentist and leads our dental clinic, and she can share more about what oral health care looks like in the community of Sioux Falls. So, Dr. Olson?
Hi, good morning, everyone. Thank you, Joe, for the introduction. I'm Dr. Susan Olson, and I currently serve as the dental director here at Falls Community Health. I've been with the city now for about 3 years, but before working here, I've practiced in California, Nevada, and Alaska. Although I wasn't born and raised here in Sioux Falls, this community has quickly become like home for me, my husband, and our kids. But today, I'd like to take this opportunity to highlight the good work that's being done in our dental department. Like Joe was saying, Falls Community Health is unique in the sense that we're graciously supported by the city, but we are also a federally qualified health center. And what that essentially means is that we are here to serve our patients in our community regardless of their ability to pay. Now, we do predominantly accept Medicaid, but a portion of our patients have private dental insurances, and some are also uninsured. Patients have the opportunity to apply for discounts for the services that they receive from us based on their household income, which really helps remove any financial barriers and really bridges that gap for care. Our dental department operates across 4 locations. We have our main site here in downtown, but we also have 3 school-based locations at Hayward, Hawthorne, and Terry Redland Elementary. At our school sites, parents can enroll their kids into our program, and we can take the kids out from class during the school day to provide their care. I think this is really neat because it eliminates any transportation challenges that some families may be experiencing, but also it prevents parents from having to leave work to take their kids to appointments. So still all ensuring that these kids are getting the care that they need. On average, our dental team sees about 10,000 visits in a year. Preventative and routine dental care It's not about just having a beautiful smile. It's more than that. It's about preventing infection. It's about reducing hospital visits, and it's even saving lives. Untreated dental infections can lead to serious life-threatening complications. Just a few weeks ago, we had the community health assessment, and some of the statistics were a little bit concerning. 60% of children under the age of 20 who have active Medicaid did not receive any preventative dental services. And when I say preventative dental services, it's simply an exam and a cleaning with the dentist or hygienist. Just this last year, 12% of high school students had to miss school because of a dental problem. These numbers, these percentages, it highlights why breaking down barriers to dental care is more important than ever. A few of the things that I'm really proud of our team in doing, some of the outreach programs that we do annually is we screen all the students at Hawthorne, Hayward, and Terry Redland from early childhood to 5th grade. And in these screening appointments, we ask the children if they're experiencing any pain or if they've had ever any pain, what their oral hygiene habits look like. And we screen them, we look inside their mouths, we make sure that we don't see anything too alarming, and if we do, if we see a lot of cavities, if we see active infection, or we see damage to permanent teeth, we make sure that we provide these families with our information at our school-based clinic so that we can help them receive the care that they need. Twice a year, we also provide what we call a free fluoride day, and it's with parental consent, but we're able to provide fluoride for these kids free of charge. On a personal note, being a dentist at Falls Community Health has been one of the most fulfilling decisions I've ever made in my life. I think in any profession, but speaking from healthcare, finding meaning in what you do is essential for having a long-lasting and rewarding career. And I can honestly say that I experience that on a daily basis. I understand our patients and patients in general are very fearful of seeing the dentist, and it prevents them from seeking care. My goal, my team's goal, is to make sure that we change that perception, that we are the trusted and compassionate providers in a profession that often carries fear. My personal motto is to try to be loved in a hated profession. Our patients show us incredible gratitude for the work that we're able to provide for them, but truly, I'm the grateful one. Patients help to give me passion and just fulfillment in my career. And they help fuel me to be the best dentist that I can be for them. As Joe mentioned earlier, it is Dental Assistant Week. And I want to thank all the dental assistants out there for helping to provide care. But I'd like to give a special thanks to the dental assistants at Falls Community Health, because without them, we would not be able to do what we do. I've been practicing for a little over a decade, and this may seem a little hyperbolic when I say this, but this is the best place that I've ever worked. I get the privilege of working with such a dedicated team committed to making sure that the patients that are most vulnerable in our community are receiving care. From leadership to support staff, everyone has the same mission. Everybody has the same goal, and that's to put patient care as an utmost priority. We want to grow, we want to expand our reach, and we want to continue to make a positive impact in our community. So if this resonates with you, whether you're thinking of going into the dental field, or if you're already a dental professional and you have that calling to serve, please don't hesitate to reach out to us. I've moved across multiple states to be a part of this team, to be a part of Falls, and to be a part of this community. And I am truly happy and I'm grateful. And I think I can speak on behalf of my staff that they share the same sentiments about being employed with the city. And with that, we are happy to take any questions.